I am glad you are here today for another important and highly informative lecture. In today's video, we are going to cover a very critical topic in forensic medicine. The topic is modern techniques of child age determination. This is one of the most important subjects in both forensic science and legal medicine. Age determination plays a vital role in courts, child protection cases, and criminal investigations. So without any further delay, let us get started. Before jumping into the techniques, let us first understand why child age determination is so important. In many parts of the world, especially in developing countries, birth registration is incomplete or entirely absent. In such cases, the exact date of birth of a child is unknown or unverifiable. Courts frequently require accurate age determination when a child is a victim of abuse, trafficking, or any criminal act. Age is also a key factor in child marriage prevention, as the law strictly prohibits marriage below 18 years. In the juvenile justice system, whether a person is tried as a juvenile or an adult depends entirely on their age. Immigration authorities also use age determination for unaccompanied minors seeking asylum. Furthermore, in cases of sexual assault, establishing that the victim is a minor is legally crucial. Therefore, accurate and scientific age determination is absolutely essential in the modern legal and medical framework. There are several modern and well-established techniques available for child age determination. The first is skeletal age determination, also known as bone age assessment. The second is dental age estimation. The third is radiological method using X-ray, MRI, and CT scan. The fourth is sexual maturity rating, commonly known as Tanner staging. The fifth is DNA methylation analysis, which is the most advanced modern technique currently available. And the sixth is anthropometric measurement. We will now discuss each of these methods one by one in complete detail. The first and most widely used technique is skeletal age determination. In this method, the maturity of bones is analyzed to estimate the age of the individual. At the time of birth, many bones in the human body exist as cartilage. As age progresses, this cartilage gradually converts into hard bone, a process known as ossification. The appearance and fusion of ossification sensors follow a predictable and age-specific pattern. By analyzing these ossification sensors through X-ray images, we can estimate the age of the child. The wrist joint is the most commonly used site for skeletal age assessment. Two of the most widely used methods are the Grulich and Pyle method and the Tanner-Whitehouse method. In the Grulich and Pyle method, the X-ray of the left hand and wrist is compared to a standard atlas. The Tanner-Whitehouse method assigns scores to individual bones of the hand and wrist for a more precise result. This technique is effective for children between the ages of 0 to 18 years. It remains one of the most reliable and most commonly applied methods in forensic age estimation. The second important technique is dental age estimation. The development of teeth follows a very specific and predictable sequence, making it highly useful for age determination. In humans, there are two sets of teeth: the deciduous teeth, also called milk teeth or baby teeth, and the permanent teeth. The first deciduous tooth usually appears around 6 months of age. By approximately 2 to 3 years of age, all 20 deciduous teeth have erupted. At around 6 years of age, the permanent teeth begin to replace the deciduous teeth. The last permanent tooth, known as the third molar or wisdom tooth, erupts between 17 to 21 years of age. The most widely used method for dental age estimation is the Demirjian method. In this method, the orthopantogram, which is an X-ray of the full jaw, is used to examine 7 specific teeth on the left lower side. Each tooth is graded from stage A to stage H based on its level of calcification and development. These scores are then converted into a dental maturity score, and finally correlated to a specific age. The Demirjian method is effective for children between 3 and 17 years of age. In many studies, dental age estimation has proven to be more accurate than skeletal age determination. The third technique is the radiological age assessment method. This method uses various medical imaging technologies to assess bone development and age. Standard X-ray is the most commonly used radiological tool for age estimation. X-rays allow visualization of ossification centers, epithelial plates, and the degree of epithelial fusion. MRI, or magnetic resonance imaging, is used to assess cartilage and bone marrow changes without radiation exposure. CT scan, or computed tomography, provides detailed cross-sectional images of bone density and internal structure. The medial end of the clavicle, also called the collarbone, is a very important landmark. Fusion of the medial clavicular epiphysis typically occurs between 18 to 30 years of age. This makes it particularly useful for distinguishing adolescents from young adults in legal cases. Other important sites include the femoral head, the iliac crest, and the knee joint epiphysis. Radiological methods are non-invasive, relatively affordable, and widely available, making them highly practical. The fourth method is known as Tanner staging or sexual maturity rating. This technique was introduced by the British pediatrician Dr. James Tanner in 1969. It assesses the physical signs of puberty to estimate the age of a child or adolescent. Pubertal development is divided into 5 distinct stages, from Tanner Stage 1 to Tanner Stage 5. Tanner Stage 1 represents the pre-pubertal state, where no secondary sexual characteristics are present. Tanner Stage 5 represents the fully mature adult state, with complete development of secondary sexual characteristics. In males, the assessment focuses on testicular volume, penile development, and pubic hair growth. In females, the assessment focuses on breast development and pubic hair growth. Menarche, or the onset of the first menstrual cycle in females, is also an important milestone. This method is generally applicable for children between 8 and 18 years of age. However, it must be conducted with extreme sensitivity, cultural awareness, and ethical considerations. The presence of a guardian and proper informed consent is mandatory during this examination. The fifth and most advanced technique is DNA methylation analysis. This is the most cutting-edge and scientifically precise method currently available for age estimation. DNA methylation refers to a biochemical process where a methyl group is added to specific sites on the DNA molecule. These methylation patterns change in a predictable and age-dependent manner throughout a person's life. By analyzing these patterns from a biological sample such as blood, saliva, or buccal cells, age can be estimated using a special computational tool known as the epigenetic clock. The most well-known model is the Horvath clock, developed by Professor Steve Horvath in 2013. Using the Horvath clock, age can be estimated with a margin of error of approximately plus or minus 3 to 5 years. Other newer models, such as the Hannum clock and PhenoAge, have been developed with even greater accuracy. DNA methylation analysis is particularly useful in cases where skeletal and dental methods are inconclusive. However, this technique currently requires specialized laboratory equipment and expertise. It is also relatively expensive, which limits its widespread use in routine forensic casework. Nevertheless, scientists believe that this method will revolutionize forensic age estimation in the coming years. The sixth method is anthropometric measurement. Anthropometry refers to the scientific measurement of the human body and its proportions. In this technique, measurements such as height, weight, head circumference, chest circumference, and mid-upper arm circumference are taken. These measurements are then compared against standardized WHO growth charts for a specific population. Based on where the child falls on the growth curve, a rough estimate of age can be made. This method is simple, non-invasive, inexpensive, and requires no specialized equipment. It is particularly useful in field settings and in resource-limited environments. However, anthropometric measurement alone is not sufficiently reliable for legal purposes. Factors such as malnutrition, chronic illness, and genetic variation can significantly affect body measurements. Therefore, this method should always be used in combination with other more precise techniques. Now, the important question is, which single method is the most accurate? The honest answer is, no single method is perfect on its own. Every method has its strengths and its limitations. For this reason, forensic experts always recommend a combined or multi-method approach. In practice, this means using skeletal age assessment together with dental age estimation and a clinical physical examination simultaneously. When all these methods are combined, the accuracy of age estimation increases significantly. In courts of law, the report submitted by a certified forensic expert carries immense legal weight. A medical board is often constituted by the court to assess the age of a child in disputed cases. This board typically conducts an X-ray examination of the wrist